So the first one is, how are we ensuring the voice of people is being heard at every level? So maybe Kate, if you start, and then I'm sure everybody will have an opinion on this one.
So I can talk from the third sector perspective. The VCSE Alliance, under the fantastic leadership of Kate Scribbins of Healthwatch, has brought together a number of third sector organisations so that we can sort of collate our voice, and we are figuring out lots of ways in which we can interface with the system on that, with the Surrey Heartlands system. So did you say the voice of patients specifically? Residents? People, yeah, not patients. You're absolutely right, Claire, right to correct me. The voice of people can get in. So a lot of the voluntary sector organisations have access into people, and some of the most vulnerable people, or some of the most marginalised, some of the ones that most need to have their voice heard. And then through Claire, we are doing, Kathy, is chairing the voice group, which we're feeding into from the third sector. So I think there's a lot of work going on. I think there's a lot of progress going on. But I think there's more to be done. And often the word voice is used, and I actually, like more the thought of co-production, and moving it on to actually creating things together, not just listening to people, then going away and doing our own thing in our own rooms. So I think there's a real conversation to be had about, I'd like the question actually to be, how are we doing on co-production, not just on voice.
Thanks, Kate. Tim, do you want to talk about it? Because the council is doing a lot in terms of identifying the communities and getting co-production with the people who live in Surrey.
Indeed. I have to say, as an elected councillor, I don't... there's not a shortage of hearing views from people. This week it's potholes. Next week it will be about the council tax increase, I suspect. So, but there is an element of that sort of democratic process, and I spend in that role a lot of my time with my residents, listening to their voice. And indeed then at a council level we get that overview across the whole of the county, and I think that is perhaps part of some may say the issue with the NHS. There isn't that sort of, if you like, democratic accountability. It's quite difficult for people to get their views across around what is happening on a health perspective. Obviously the Health and Wellbeing Board is there to in part to address that. I think, I mentioned earlier the piece of work that's been done jointly between the local authorities and the health system around that subsidiarity and looking at towns, the 30 to 50 sort of footprints, as a way of making sure that we can truly engage in those localities. There's a lot of work that's gone on and going on in terms of having identified, particularly post-COVID, those localities that have significant issues of deprivation, and there are five wards in Surrey, 5 areas in Surrey that are in the top 20 areas of deprivation in the country. So those are sort of not pilot areas, but there's a lot of learning that is coming from that, and Ruth Hutchinson, I saw somewhere, and her team through public health are really engaged in driving that work. So I think the good thing is, and we're getting a lot more data. That if you go onto Surrey Eye, you can see a lot of information down to that local super output level in terms of what is happening. So I don't think the challenge at the moment is necessarily hearing what people are saying. The challenge is actually doing something about what they're saying.
So one of our hindrances in Surrey is that we have an incredibly articulate, successful population who are very good at getting their views across. We have got more head offices than anywhere else in the country. It probably means we've got more retired chief executives than anywhere else in the country. That is both a curse and a blessing, isn't it? But to counteract what can be an incredibly effective, articulate, single issue voice, we set up the citizen panel, and Rich Stockley is here, which has made sure that we had the demographically representative voice of the people of Surrey, which can, I'm not deriding the importance of the single issue voice, but it is really important that we hear from everybody, and in particular those people that may not necessarily have their voice heard. And I also want to give a shout out to the role of complaints teams in organisations. So I think we underestimate sometimes as NHS organisations, I think that Tim, the council are better at this, but every time somebody writes a complaint, it means that they are incredibly distressed because nobody wants to do that, and our natural instinct actually is to hold that in. And as a system, I think the way we view and handle complaints is very different, as viewing it as an opportunity to make patient services better and to work with patients. So it is just a big shout out as ever to the complaints team.